of patients who come to us, obviously a lot of patients come with their partners. They don't come by themselves. And apart from the patient themselves having, worries or anxiety about their surgery or post-surgical status, the partners are worried. They're nervous, they're anxious, whether it's okay for them to touch their partner. Are they going to cause more damage? Are they even allowed to touch them where they have surgery? Are they allowed to do anything? Are they allowed to move them? But I think they ask us less of that, and they probably ask you all more of that. What are your thoughts on this?
Yeah, that's a really, really good question, a really good point to bring up. We forget, don't we, that there's somebody else involved when you're talking about anything from a relationship point of view. And we do focus on the patient, but actually there's a loving partner that wants to do everything possible to help alleviate the suffering that they see in their loved one, but also to help with their recovery. And there's lots that they can do. So I think getting partners involved is a really, really important part of what we're talking about today. Really basically, you're not going to hurt them or cause any damage to their healing tissues post-operatively by touching them. So massage, a cuddle, just even a gentle hand on the arm are all acceptable things that aren't going to cause any problems. And actually they're the things that people really struggle with because they're so frightened. So I think the best way again is practically to show you some really nice massage techniques that you can do both away from the injury and away from the operative scar, but also around the injury and around the operative scar. What we don't want you to do is to be frightened of actually touching the injured area, but it's sometimes nicer to start away from that because the partner's got to build their own confidence. But I think also for the person having undergone the injury or the surgery, they need to build trust in their partner.
No, that is
so it's a trust and a relationship bond which will carry directly over into sexual activity, which again is something that we're going to focus on.
Yeah, no, that's really important because it's important to rebuild that trust again, and for the person having the surgery or the injury to understand that it's okay for him or her to touch me, and to also accept that this is a good way to start. On another front, do you normally have sessions for couples when you have rehab sessions, or is it just individualized? Usually, do you actually allow the partner to come in? Or?
Well, I mean, again, a really good question. I don't think we really broach it generally. I think as physios, we direct the treatment to the person. Certainly, I would always invite the partner along and say they're more than welcome to attend. But I don't think we actively say, bring them in, let's do a joint session. And I think we probably should. And I think that's something that, talking particularly about sexual activity and relationships, it's not a one-person thing. It's a relationship, it's a couple, it's a joint activity.
I agree.
So it's really important that while we're talking about exercises and desensitization, that we do it as a couple.
Yeah, so I think it's a good point to bring forward so that they understand, and maybe some patients are a little scared to even ask the medical professionals involved if they can come along versus if they can bring their partner along. So it's probably good for them to know as well that it's not bad to ask, and it's not bad to be prepared to do what it takes to bring back their relationship the way it used to be.
Yeah, absolutely.
So, yeah, that's good. I think the videos that come up ahead showing them the various procedures they can do, or the massages and the techniques, will really help.
Yeah.